Good morning, everyone. It's time for a Henry County Health Center FYI. And in observance of February as American Heart Month, this morning we're talking with Andrea Moeller and Jessica Krogmeyer from the Henry County Health Center. They're here to talk about cardiac services at HCHC. Good morning, ladies.
Good morning.
Good morning.
Well, first, let's just start off with introductions. Introduce yourself and what you do at the Henry County Health Center.
I'm Andrea Moeller, and I work in cardiac rehab. I've been at Henry County Health Center for 22 years, and 20 of those years in the cardiac rehab department. I went to college at the University of Iowa and graduated with a Bachelor of Science in Nursing.
Hello, my name is Jessica Krogmeyer, and I'm a nurse here in the cardiac and pulmonary rehab at Henry County Health Center. I graduated from Iowa Wesleyan University in 2016 with a bachelor's degree in nursing, and I also am a graduate from SCC's respiratory therapy program in 2005, and am a registered respiratory therapist. I have been at Henry County Health Center for about a year. Prior to Henry County Health Center, I have experience in multiple areas in the hospital systems.
Fantastic. Well, thanks, ladies, for coming on this morning. Andrea, do you want to talk about how the cardiac rehab nurses work with cardiac patients?
Yeah, the cardiac rehab department is staffed with 2 nurses, and we both have background in critical care. The cardiac rehab program is nationally certified by the American Association of Cardiovascular and Pulmonary Rehab. In cardiac rehab, we track patient outcomes, such as their exercise improvement, their nutritional habits, and their emotions. And with that information, we submit it to the American Association of Cardiovascular and Pulmonary Rehab. And with the certification, it demonstrates that we are current with national standards.
Fantastic. I know so many people in our community who have used the cardiac rehab service, a specialty clinic here at the Henry County Health Center. So why don't we talk about the visiting cardiologists who get to see people right here in Mount Pleasant? Why is it beneficial for us to have access to these specialists locally?
Yes, it's a great benefit for our residents. Great River Cardiology from Burlington and Iowa Heart Cardiology from Mercy Hospital come to the specialty clinic throughout the week. And it's great for our patients. It's convenient being local, and it saves them a trip out of town.
Jessica, it is Cardiac Heart Month, American Heart Month. And so let's talk a little bit about one of the biggest things that happens with cardiac situations, heart attacks. Do you want to give some information about the signs and the symptoms of a heart attack and what people maybe should be aware of in case they are experiencing one themselves or somebody around them is starting to experience one?
Yes, signs and symptoms of a heart attack can be, it doesn't have to be all of the things that I tell you, but it can be all of those as well. Neck or jaw discomfort, chest pain, possibly even a burning chest pain, left arm pain, so that pain in your neck and jaw could radiate down your left arm. Also back pain and pain between the shoulder blades, cold, clammy skin, sweating, feeling dizzy or lightheaded, even indigestion, nausea, vomiting, upper abdominal pain, and shortness of breath can all be indicators of an issue with your heart, and you would want to seek medical care.
Let's talk about the cardiac rehab department here at the health center and the services offered. Can you explain? I know there's 3 phases to the cardiac rehab program.
Yeah, the first phase is as an inpatient. After a person has a cardiac event, a therapist would have the patient perform exercise while monitoring their heart, making sure they're safe to be discharged to home. The next phase, the phase 2, is an outpatient cardiac rehab. That is after the patient is discharged from the hospital. Once again, in phase 2, which that is what we do here at Henry County Health Center, we monitor their heart, their blood pressure. Patients usually attend 2 to 3 times a week for about 12 weeks. And then phase 3 is a maintenance program, and this is nice if the phase 2 patients want to continue. We still monitor their blood pressure and heart rate, and a nurse is here to supervise, helping them with their exercise plan, and if any problems arise, the nurse is here for that supervision.
So it sounds like patients can become involved in the program after maybe they have a heart attack. Is there other ways that patients can get involved with the cardiac rehab program?
Yeah, if a patient is interested in the maintenance program, they can give us a call here at the hospital. It does require an order from the physician, which is usually easy to obtain. The phase 2 patients, we usually get the direct order from the physician when the patient is discharged from the hospital.
So how does cardiac rehabilitation help improve quality of life for people?
Yeah, I think it's a great way to improve your quality of life. It gives patients that reassurance that their heart is functioning well. We are constantly monitoring their heart rhythm, checking their blood pressure and their heart rate. We hope patients see an improvement in exercise tolerance and gain strength, even making their day-to-day activities seem easier. The patients are also educated on managing their stress, eating healthy, exercise and home exercise, and also on their medication. And we want patients to be aware of their risks for heart disease and make changes for a healthier lifestyle if need be.
Jessica, what diagnostic tests are available at the HCHC, and how do these tests help evaluate heart health and diagnose heart problems?
The diagnostic testing available here at Henry County Health Center include EKGs or stress tests, which will allow the doctor to see electrical activity of your heart, whether that be at rest or with activity. We also have heart monitoring available, such as Holter and event monitors. They give the provider more information regarding the electrical activity of your heart over a longer period of time. The radiology department also has echocardiograms that they do. They give the doctor information about the heart's ability to pump blood efficiently. And we also have cardiac nuclear medicine for diagnosing and assessing coronary artery disease.
Sounds like overall we've got fantastic cardiology, cardiac services here at the Henry County Health Center. So if people have more information on what maybe we've talked about today or the services that you guys offer, who should be contacted?
Yeah, they can call our direct department's number at 319-385-6504, and that's the Cardiac Rehab Department.
Okay, Andrea Moeller, Jessica Krogmeyer, we're talking about the cardiac services at HCHC and American Heart Month here in February. Is there anything else that we didn't mention or I cut in too soon that you would like to talk about?
I don't believe so.
I think we covered it.
Fantastic. All right. It is American Heart Month, and I want to say to you two, thank you so much for all that you do for our area residents. I know so many people who have learned a lot from their cardiac rehab and still keep in touch with other patients that they met going through their cardiac rehab, and I know that you guys are doing a fantastic job down there. So thanks for coming on KILJ this morning.
Thanks for having us.
Yes, thank you.